The doctor is in.
Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at sciatica nerve pain. Sciatica is a real pain in the arms. What I'm going to do is I'm going to show you in this video, I'm going to lay out before you several different options or approaches that we can use to treat or subside the horrific pain from sciatica if you're suffering with it. But first off, let's first explore what causes sciatica or what is sciatica in the first place. So I got Buddy here. So if I imagine he's standing up here, this is Buddy. This is called his lumbar spine. This lower part of his spine under the thorax is called the lumbar spine. Now, if I could pull out and magnify his lumbar spine, this is what it would look like. So I'm going to bring this up close here. So that's from the side, and then I'm going to turn it to the front. So if I took this out of my lumbar spine, it would come out like this. And what you'll see is that between each of the bones of my back, there's these little juicy donut shock absorbers called discs. You'll also appreciate that there's nerves sprouting out from each side of the spinal column. And each of these nerves supplies a different part of your lower bum area and legs. So say this guy here would supply, say, the inner part of your thigh. This guy here might be supplying the side of your leg. This one here is supplying the front here, side here. And down here, another one is going to supply the back of your leg. Now, the problem with sciatica is that the bones are pretty much fixed, they're inflexible, but these guys, the shock absorbers, they're the weak point in the chain. So if I look at it from the side there, you can see here, these shock absorbers get squeezed. So say you go bungee jumping or jumping on a trampoline, those compressive forces are passed through the spine and bounce through these shock absorbers to avoid smashing or crushing or cracking these bones. The problem is that sometimes the shock absorbers fail, and as you can see in this little red spot here, this disc here has blown. So in other words, it's exploded, its contents, it's flattened itself out and pushed out. The problem is that that jello sticking out there can press against the nerve. And that nerve, say this one was supplying the side of your leg, would make you feel as though there was electricity shooting down your leg. Even though there's nothing actually wrong with your leg, it's the signal is emanating from here and passing a phantom signal up to your brain that there's injury occurring. So that's what causes the pain in the ass. Now, different treatments. Basically, I like to remember as 4 different P's. So the first P is pills. Second P is physical therapy. Then there's pins, and then there's operations. So let's start with pills. 90% of cases of sciatica will clear up within about 6 weeks, but sometimes the presentation can be extremely dramatic. And it doesn't always take a huge impact that you would think it would need to cause severe dysfunction. You might think that it needs basically to get hit by a sledgehammer to cause one of these discs to rupture. Sometimes I've had people just bending over to tie their shoelacing that suddenly the disc ruptures and puts them in agonizing pain. Sometimes so bad they're calling for an ambulance to take them to the hospital. So what I actually believe happens is that the weakening process of the disc is probably going on for a long period of time, but it only needs that final straw in the camel's back to break it. So the mainstay for tablets for treating sciatica is one, basically just a painkiller. So say like an opiate, morphine, codeine, some kind of painkiller to hide or mask the pain. Typically something like acetaminophen or Tylenol by itself is too weak for this type of problem. So unless it's combined with another opiate, say like acetaminophen with codeine, is typically too weak. The other mainstay of treatment is to try to, if you assume that this swelling is reversible, then if you use an anti-inflammatory, theoretically you should be able to shrink that swelling, pull it away from the nerve, and go home happy. So the second component of therapy is typically using what we call an NSAID, a non-steroidal anti-inflammatory. So that would be your stuff like Advil, Motrin, There's a whole bunch of different ones. Aleve, Mobicox, Celebrex, blah, blah, blah. Whole bunch of different ones. They're like choosing toothpaste. All a bunch of different flavors, they all do the same thing. So whether you like Colgate or Crest, it doesn't really matter. And then the third and final thing that we'll often do is one of the dysfunctions that occurs from the nerve being pinched is not just signals going up to the brain, falsifying injury to the brain and causing pain, but also signals can be passed down into the muscles of the leg, causing spasm, which causes even more pain. So the third thing that we'll usually add for an acute exacerbation of sciatica would be a muscle relaxant. So that would be something like either Valium, Flexerol, cyclobenzaprine. There's a bunch of different ones, Robaxet, whatever. That's not always essential though. The most important thing is usually just the opiate for pain relief, and the NSAID is the main driver for recovery. All right, then next step you might want to consider after it starts to settle down a little bit. Obviously, if you're in an acute crisis, you can't start physical therapy. But if you're not and you're starting to settle down, you could do physical therapy. Some of the things that they do is methods of flossing the nerve to get it past its this impediment here. You floss it up and down, boom, boom. So if you floss it through, it kind of rubs away at the irritation. The other thing some physio clinics will do is a wrap procedure where you basically get stretched out. And as they stretch you out, what that's doing is pulling the affected discs apart, pulling them away from the nerve. And then there's a bunch of other stuff that they're doing there, like a black box. I'm not a physiotherapist myself, so I typically just send people there. They get better, they come back to me, they're happy, I'm happy. The next thing sometimes I'll have to do is send people to see an anesthetist for this third one here, which is pins. And by pins, what I mean is basically needle therapy. I'll just stick on the operation here too. With the needle therapy, again, the idea is to shrink this impediment here that's pushing against the nerve. So an anesthetist can use a needle. It actually doesn't look like mine at all. It's a much longer needle because you're trying to traverse all this space here in the back, all these muscles, fat, nerves, etc. to get in. So it's a much longer needle than what I'm demonstrating with. But the basic idea is you're trying to get an anti-inflammatory. So this is going to be filled up with the anti-inflammatory. Now this time the NSAIDs are non-steroidal, but typically for this procedure we actually use a steroid, so steroidal anti-inflammatory. So say I'm using, say in this case here I'm using Kenalog or Depomedrol. What I'm trying to do is infiltrate it to this area here, bathe this region here where the disc is poking out. By doing that and leaving that in the area, what that does is hopefully cause the region to shrink. Now again, for most cases of sciatica that are typically only going to last for 6 weeks, 6 to 8 weeks, there's no point going for this. But there's some unfortunate people where it drags on for months on end. Those are the cases where it's move away from just step 1 with the pills and step 2 with physio to 3 the pins and finally operation. Now number 4, the operation, is reserved for the worst of the worst. So these are people that either the pain is so intractable that's debilitating and it's not going away, so at least 3 months of debilitating pain to the point where there's loss of employment, loss of effectiveness at home, etc. And in those individuals where it's so severe that it actually causes muscular dysfunction in the affected limb. So this person can't walk anymore. For these kind of extreme cases, then we can consider operations. And there's many different operations that can be done. The most common would be a discectomy, where you basically trim away the bad segment, the bad disc edge here that's impinging against the nerve. There's also rodding procedures where you basically place a rod across the bone, stopping them from moving, reducing pain. And I mean, there's other procedures too, but I'm not an orthopod, so that would be the extent of my knowledge base in that area. Typically, if I have a patient that's had intractable symptoms for a protracted amount of time, then I will hook them up, make a connection for them to see orthopedic surgeon to consider surgical options. So just to recap, the main thing to remember is that most cases, if this is the first time it's happened to you, there's a very high probability this is not going to last, even though it feels like the end of the world right now. There's a good chance that within the next 8 weeks, you're going to be completely tickety-boo back to normal. So this is basically so you can make an informed decision if you are suffering with one of these problems and you want to consider, well, what are my options next? You could just consider this quick little video tutorial on how we treat sciatica medically. So thanks again for watching. Don't forget to subscribe and share this with anyone who may be suffering with sciatica at this moment. And have a terrific rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.